Hey there, I'm Eunice. I suffer from stage 3 kidney failure, seizures, something's going on with my heart, I'm not really sure, and side effects. Right now, I'm at a neurology appointment for my seizures, and then after that, I'm getting a holter monitor put on me for 30 days-ish, and then after that, I have a counselor appointment, so come on. Good morning. All right, today I have a doctor's appointment with neurology to see how my seizures are doing, and then also with the tilt test where they were bringing me up and down. So let's see what happens. I'm gonna try to film it, but I'm not sure. I'm wearing Nikes, athletics like always, Buff Bunny, and a jacket from Shein. All right, let's go. Good morning. Good morning. How's it going? Good. We're here, right? I have an appointment here at now. Eunice, June 7th.
And you're here for neurology?
Yes.
You'll have a seat all the way at the end.
Perfect. Thank you so much. You have a good one. I'm in the clinic and I'm inside. For a moment there, they took my blood pressure and it said 198/64, I think they said. And I'm like, what? And then she took it again and it was 111/74. I was like, something serious must be happening if it's that bad.
Good morning. How are you doing? Hi, how are you?
Good, how are you?
Let me get on the computer here real quick.
I'm drowsy, I'm sorry. The medicine.
That's okay. I understand for sure. All right, let's see here. Okay, Miss Eunice, what's your birthday?
June 7th.
Thank you. Okay, so it looks like the last time I saw you was back in January. At that time, you were kind of complaining of the Briviac. We switched you over to the Clozam. Are you taking a half tablet twice a day or one tablet?
One tablet.
Well, that's right. We started you at a half,
And then we went,
put it up
yeah.
to one. Okay, so you're taking one tablet twice a day. We continued the lacosamide.
Yes.
And you're taking one tablet twice a day.
Yes.
Okay. When I saw you on the 8th, you had had a seizure on the 4th, and it was when you were starting to fall asleep. You kind of had this fearful.
See of calling me like right at the
I'm trying to remind you or something.
Yeah.
Yeah.
I do see the new medication is working a lot better. I'm getting like probably like one. I made it up to a month and a half without a seizure, which is a lot for me. So it is working. The only thing it is that I do get really drowsy.
It can make you drowsy.
I go to sleep. I wake up, I take the meds, and then I go to sleep like within 2 hours.
Okay. Sometimes what you can do with those medications is like take your morning lacosamide, wait an hour, then take your morning feed.
Oh, okay.
That way you don't get that,
The whole,
that big, all of a sudden sleepiness, to kind of get a little bit, and then you get a little bit, you take yours and you get a little sleepy maybe, because lacosamide makes you sleepy too. And then it just doesn't give you that big dip of sleepiness. So you might want to just try that and see if that helps.
Okay.
Okay.
Is that a little brain on your clip? That's cute.
Yeah. I don't know if you know probably Elaine in the epilepsy monitoring unit, the nurse practitioner over there. She made those for all of us.
That's cute.
Yeah, she's so crafty. I wish I was that crafty. And how before this one, when did you say your last seizure was? So it generally occurs when you go to bed or go to sleep or wake up?
Yes. That's the scary part. It's actually a good question. Do you recommend me having a dog?
Pardon me?
A dog? A service dog that could probably jump on me or if I'm having a seizure at night?
They talk about those service dogs. Yeah. I really don't know. I know insurance doesn't cover them. They're very expensive.
Yeah, they're like 30,000.
Yeah, and I think that if that's something you'd like, that would be fine.
The thing that scares me is during the night. And I would like a dog that would, I'm trying to find one, but that would jump on me or like take the covers off or jump on him. Yeah. That way, he would try to wake me up.
Right. And I think they also have some kind of watches or something that can sometimes notify you. They get kind of things.
Oh, that's cool. Or he knows it's coming or...
Yeah. What happens is before a seizure, what happens is your heart rate goes up real fast, so it can monitor the heart rate, and it can, and it's not like a working out heart rate where it gradually inclines. It just shoots up.
Oh, okay.
Seizure alert bracelet or something. And another thing you could do is go on to the epilepsy website, and a lot of people have different ideas of what to do. They're very good about
Equipment and stuff that you
oh
can do.
yeah, and a lot of these people have tried it. They can tell you what's good, what's not, what's helped them. Let's see, I think it's the Epilepsy Foundation, epilepsy.com.
Okay.
American Epilepsy Society.
Oh, okay.
I think they have, we don't have a organization here. The San Antonio has a real good organization. So everybody's kind of going to this, joining the San Antonio.
Yeah.
And they go to their website. And they sometimes have like, they have the blogs, and they also have like videos or things like that to talk. And my patients have really enjoyed it. And you can really learn a lot of what's available out there.
Okay.
So you can just log on American Epilepsy Society.
You want to put it in a note?
Yeah, I'm gonna put it on here for you.
Thank you.
So I got it on here for you, okay?
Thank you.
And that can be a really good. That can be very beneficial.
Thank you. Thank you.
Okay. Any emergency room visits since the last time I saw you?
No, no, I don't think so. No.
I see you went to the
Tilt test?
neuromuscular, the tilt test done. Yeah, autonomic testing back in March. It kind of showed a little bit of vasovagal syncope, which could have been associated with anxiety and hyperventilation, but they didn't feel like there was anything wrong with your blood pressure or anything.
I was seeing the results, and that kind of, I saw that there was a malfunction. So that kind of got me a little worrisome, honestly a little upset, where the malfunction and the fact that they say it was anxiety. I went to my psychologist and we were talking about it. And I think she made a note, I'm not really sure she made a note, but she's like, I don't think that's anxiety, that's something else.
Okay. So, well then maybe she should read the report.
Okay.
Have her read the report and see what, I mean, that's Dr. Fernino, he's the chief of our department.
But it was another doctor that
Yeah,
did it.
but he reviewed all the testing.
Mm-hmm.
He reviewed it all. But do have her read it and see what she thinks.
She read it.
Okay, good.
She read it, and she was
Yeah,
still
she needs
saying-
to talk to Dr. Fernino.
Okay, so I told her to talk
Yeah.
to Dr. Renee.
So if she has any questions about it, to talk to Dr. Fernino. That's out of my specialty. I don't do autonomic testing, just epilepsy. So that's why you would see them, because he's not an hepatologist, Dr. Fernino.
Okay.
So I would definitely have her, if she has any questions about it, just speak with him. Okay. Yeah, and then, because maybe they want to do a repeat.
Because when I was in the not in the ER, I was in the ER, and they sent me to the epilepsy unit. And the epilepsy unit, they did make a comment saying that it might be that I'm not getting enough blood flow to the brain, because as they were making me work out. So do they still think it's something like that, or?
I didn't read that on there. Let me find it, put it in here. That was back in July.
No, that was this year.
Oh, that was in February. Yeah, and it just said that they saw 4 events. First 2 were with the blood draw, and it was triggered by exercise. So it was just taken while you were taking the blood, taking the blood draw. So it didn't have anything to do with
The brain, essentially,
that into the brain. Yeah, it was the blood draw from the arm. And the last event triggered by exercise is most likely a pre-syncopal etiology.
Remind me what I know pre-syncopal, but what's etiology? Sorry, what you said.
Etiology, that's what it's meant, that's the cause.
Okay.
And when we have an etiology, like some people have seizures because of a tumor, so the etiology would be the tumor that's causing the seizures. Okay. So they think that it's the exercise is most likely pre-syncopal, which is where you don't pass out completely, you don't lose consciousness, but you do get sometimes tunnel vision, and like you're going to pass out, but a syncopal event is when you just drop and fall. Pre-syncopal is like you're just going to feel like it. Okay. And then the third event, taking iron supplementation, and it wasn't epileptic, it showed no epileptic discharges.
They told me it wasn't epileptic.
And they thought it could be pre-syncopal also.
So would this be heart related then? Do you think so?
I think they sent you to a cardiologist, or you're seeing a cardiologist.
I am seeing my cardiologist, but I've been having trouble.
Yeah, and so that's another thing we have to check out. We don't know. So, that's why we do the tilt testing. We make sure it's not seizures, because there's only certain things that can make you lightheaded and pass out. Heart, brain, maybe your ears if you have vertigo, you
Yeah.
know, and falling, maybe your ears. Those could be the only things. Most of the time it's dehydration.
I drink water.
Yeah, that's good. Yeah, dehydration, but you also got a little bit
kidney
of kidney
failure.
problems as well.
Mhm.
You know, so so staying hydrated is good because that can also cause pre-syncopal events. But yeah, we want to cover all bases. So we pretty well covered all neurology.
Okay.
Now let's go see if it's something in cardiac. Okay, because if we can find what's causing it, perhaps we can fix it.
What do you recommend me doing when they're not really paying attention to me? Like last time I went to cardiology, right now they lit up the call I was because I was pushing on another heart monitor or a what's it called, a loop monitor.
Yeah, they said that's pending.
But I had to push a little because they think it's anxiety, but it's anxiety. So what do you recommend me in those moments to do?
For when you have the loop monitor.
No, whenever doctors are saying it's not, like the cardiology, I had to push a little. They were saying that it's not there. It wasn't there because they didn't see anything in 24 hours.
On the loop monitor.
No, it was a holter.
A holter monitor.
Yeah.
Okay. Yeah, and I think they're planning on doing a loop. Isn't that?
I asked them if they could do a loop just in case it's not grabbing it, but they said no, and they're doing a 30-day.
A 30-day. Okay.
Holter monitor.
Good. Good. Yeah, and that's reasonable for now. I think that's reasonable. Because if it's happening like every 2 weeks or so, then maybe they can capture it in 30 days.
This is not your region, I know, but it goes down to 42 when I'm awake.
Yeah.
So that's a little scary, and then it shoots up to like 140, 150. So that's the scary part.
Yeah, that's totally understand. But if we don't capture it,
Yeah. So
you
you have
know,
to.
so what we're trying to do is capture it.
Okay.
That's what we want to do is try to capture it. So maybe with a 30-day we can capture it.
Okay.
Now, how long did you have the monitor on for 24 hours?
It was just 24. Yeah.
Okay. So
Yeah.
we need to do it a little bit longer.
Yeah, that's what I'm.
Yeah. And so if we can, and that's what we have to do. We have to capture it because we can't guess. I don't think you want us to guess.
No.
We want a
I like to
diagnosis.
guess.
We're not saying it's not happening. We just haven't captured it.
What would you do if I'm having an episode like that? But by the time, because it's happened, by the time the ambulance comes, the episode is.
It's already gone. Yeah. You know, if you're not, I mean, you can always go to the emergency room. We don't play with the heart.
Yeah.
If you're having problems like that, I can't say to tell you to ignore it. You know, if I started getting chest pain or started feeling bad or anything, then that would be symptomatic.
Okay.
But I don't. And it's usually if I don't take my medicine, I drink coffee. So I would say don't drink coffee. No caffeine.
I've been drinking hot chocolates now.
Yeah, no caffeine at all because that can, you know, is a stimulant. And some people's their heart's more sensitive to others on it. You know, and some people can drink coffee all day and never have a problem. I drink, you know, 4 or 5 cups of coffee. I'm gonna have palpitations. Even on my medicine, my heart's just a little more. It used to not, but I'm older now.
Yeah, for sure.
You know, so I would avoid any kind of caffeine. Okay, and there's caffeine-free teas, and also there's caffeine-free coffee.
Oh yeah.
Drink.
That's what I'm doing now. I'm
Absolutely.
changing.
I think that the pharmacist went through all of your medications too to confirm that there was any no medications.
Yeah.
That also could be causing it, which is I was really glad that he did that. That's very important too.
That was the psychologist that sent me to
Yeah.
that appointment. Are you retiring soon?
Yeah, June.
Oh, in June?
Yeah.
You're leaving me?
Yeah. That's okay. I'm going to have you well taken care of, so don't you worry.
Thank you.
Yeah. They want to. I see here that, what was it? The holter monitor was back in November. Your maximum heart rate was 138 and your minimum was 49.
I even got what are they called? I was showing my watch. They're like it's an Apple Watch. So I got one of these.
Pulse oximeter?
Yeah.
Yeah.
It catches more.
Yeah, they definitely want to get that 30-day monitoring there. So we'll see. Hopefully they'll be able to capture something on that. Okay, because we don't think it's neurologic. but
It's
we'll
more,
check
okay.
cardiac. And this is one of those things that you're not the only one. We do this a lot. People come in, we don't know if it's seizures, we don't know. But you do have seizures, plus you have this other
Thing that's
things going on. But when we captured them in the MU, they didn't have any EEG correlate.
No, yeah.
You know, so that's why we were thinking, well, maybe it's something else. You know, and that's, I think it's a really good idea to just cover all the bases and see what it is.
Okay.
Okay,
What do you think about POTS? POTS?
that's what.
What do you think about it? Yeah, POTS, it's a, well, I guess it has to do with the heart as well. It's where the heart jumps and stuff like that. But would that affect anything with the brain if I'm not getting enough, I guess, blood flow to the brain?
The one thing you're not going to get blood flow to the brain is if the heart doesn't beat.
Okay.
That's
the only.
That's the only thing. Yeah.
Okay.
That you don't. Kind of like because if your heart's beating and your carotids are open, blood's getting to your brain. Okay. So, and getting it everywhere else, but that's why your heart is just right here next to your upper chest, because the first thing it wants to go to is your heart. I mean, to your brain. You know. So, as we say in neurology, the only reason why you have a heart is to pump blood to the brain. You know, the cardiologists, they don't agree with us. We just call it plumbing. You know, it just brings blood to the brain. So as long as it's,
Yeah.
you know,
How about when you faint? Like, do you think that would trigger a seizure or anything like that?
fainting does not stop your heart.
Oh, no, but it stops the blood flow to the brain, doesn't it, for a second? Or like that's how the fainting happens?
Fainting can, well, sometimes if that's what we were checking, vasogenic. Like sometimes what happens is the veins in your legs and everything, when you stand up and you get real dizzy sometimes or something, you lose that autonomic. Your body, when you've got these receptors in your carotids, that when you stand up, it notices I just stood up. Okay, so it clamps down my valves in my legs, so my blood doesn't flow down to my feet. Okay, so the veins will hold the blood, and then they'll pump and it'll open and it'll pump and it'll open and to prevent the blood from backflowing down to my feet. So your veins have those valves in them, little valves to prevent the blood from backflowing. Okay, as you get older, your autonomic nervous system, this is something that means that you don't even know it's working, you don't have to control it, you don't have to think about it, you don't have to say, okay, I'm going to have to make my valves work now before I stand up. Your body automatically knows your position. When you lay down, when you stand up, when you sit down.
Yeah, that's why you guys do the
Yeah,
test.
so when you stand up, those valves automatically go into action. Okay, and then you have them all the way in your vena cava. You have valves wherever you have veins. Okay, even when you're sitting down, in your legs, arms. I put my arm down, I have valves. Okay, that'll keep my blood from going down, my hands from swelling. I go up like this, and the valves keep it from going back. Okay, so there is autonomic. So that's what the testing they did with the tilt table, autonomic. They were checking to see. And if that happens, your blood pressure drops.
Okay.
It doesn't mean your heart stops.
Yeah.
It just means that it just dropped from your brain for a little bit, and then it usually comes right back up. Okay. So as soon as you lay down, then everything is normal again. Okay. But as far as with your age, you shouldn't have any problems with your autonomic nervous system. You usually see it in older people who stand too fast because it's just not as reflexive. It just gets a little slower, like everything else. When you get old, it just gets slower.
Yeah.
And sometimes you just have to stand up and wait a minute before you start walking. So that would be autonomic.
Okay.
And that's kind of what they were looking for. Now we'll have to check and see what could be causing, if it's the heart, if it's, you can maybe throwing, evidently it's been doing okay. There's no regurg. Regurg means the same thing, like if your mitral valve or your aortic valve opens to let blood go through, it closes to stop the blood, from coming through. And then it opens and it closes. If it opens and it closes halfway, well, the blood inside the heart backs up. It comes back out. It has to close completely. those valves in your heart so that it can go to the next chamber of the heart, the next chamber of the heart, through the lungs and then through the body. Okay. So that's when you start seeing like any kind of mitral valves, regurgitation, and sometimes that's when they have to do mitral valve replacements or aortic valve replacements. We see it a lot in drug abusers that get vegetation on their valves because from dirty needles. Also, it can be caused by just getting older. It can be hereditary.
Okay.
Valves get lazy too. So,
Thank you for explaining that.
yeah, and that's just a very basic.
Yeah, explain it.
Yeah, you
That's
have to
my
get
name.
with
Yeah.
a cardiologist if
For
you want
that,
a little
yeah.
bit more in-depth.
No, I appreciate it.
Yeah. So those are the kind of things we're working for. And regurg, it can also make you dizzy because the heart's coming back up and it's not going through your body. Okay? And you're not getting enough. And then when it backs up, then your heart starts getting bigger because it's getting all that blood flow, and then you get an enlarged heart and all that stuff. But your valves look good. We saw that. We look at those in your echoes.
Yeah,
We look at all your valves. And we look at your ejection fraction. How forceful does your heart pump? People with heart failure, their heart will pump like this. That's not going to move a lot of blood.
Yeah.
It's not going to take it up. So the heart, it backs up because the blood's still coming in,
Is that where?
but the heart's not getting it out. And then the heart gets bigger and bigger because it keeps filling with blood. Then you get heart failure. Because you know how you get a rubber band
Yeah.
and you stretch it real wide, a whole bunch, and then it loses its elasticity because you've stretched it so much. And then you get a rubber band that doesn't stretch anymore. It just stays like this. That's the same thing with your heart. It loses its elasticity.
Okay.
Okay. But yours is nothing like that.
No, yeah. My mind is going back to in 2020. They told me that the left side of my heart was a little bigger. So that's where my mind went. I'm like, well, what?
Yeah. And I don't see anything in here about that.
Back to normal.
Yeah, all your chambers are normal. That was the one from November 2024, normal chamber sizes. What we're looking at are your aorta, your aortic, left and right, aortic, and your left and right ventricles.
Okay.
Those are your chambers. All those are normal. You have good function. Left ventricular wall motion is normal. No stenosis or regurg. Your right atrial pressure is normal. There's no effusion in your pericardium. That's no fluid in your sac that covers your heart. And then from the study dated in 2022, there was no significant change. Okay. If you have any, I'm just reading from their report. So if you have any questions with any of this, be sure to let me know.
Yeah.
But your chambers were normal.
I appreciate you for taking the time to
Yeah.
talk to me.
Yeah.
A little more in
Sure.
depth.
And don't hesitate to ask them. But if we get like a normal 24-hour holter monitor, our next plan is a 30-day.
Yeah.
Okay. Then we just kind of have this algorithm we go by.
Okay.
Okay. So they're right on track, and I think they're doing the right thing by doing that.
Okay. Thank you.
Going back to your seizures.
Yeah, sorry.
That's okay. What I would suggest, you've been doing good on the clobazam. Why don't we do 1 in the morning and 1.5 at night, and see if we can get those morning ones when you're waking up a little better.
So one of the
That way you won't have it. You just don't take it during the day, so it won't make you more sleepy.
Okay.
Just take it at night. I'm going to add just a half tablet. Okay. And then we'll see how that works for you.
Okay. Sounds
Follow up with cardiology. Any chest pain, swelling in your ankles, anything like that. Be sure to let them know. Go to the ER. Any chest pain, especially. If the palpitations continue and don't stop, let them know. Okay.
Thank you. I appreciate it.
Yeah. If you notice any passing out spells or almost passing out, video them with your phone. Make sure she's safe, of course, before you do it. But that way, it'll help us know to what could possibly be.
Yes.
And taking pictures. Is it seizure? Is it just syncope, pre-syncope?
Okay. Alrighty, well, thank you so much. I appreciate it. Thank you so
And we'll
much.
try to figure out, just try to see Is there something that occurs before this? Do I have a certain feeling beforehand? Do I feel like
I start to
dizzy?
shake.
Do I get tunnel vision? You know, do things just black out, or do I get tunnel vision? All of those things can mean, can give us some clues.
Okay, I appreciate it.
I know you've been dealing with it for a long time, and you're very aware of it, which is good. But anything you can,
Give them.
add to it, and give to them will help us as well.
Alright.
Okay. So, Eunice, I think that's all we're going to do for today. Let me look here on your labs. They did labs in April. Everything looked good. Your creatinine was 1.25.
It went better, yeah.
Yeah, so I'm glad you're staying hydrated. That's good. Avoid NSAIDs and aspirins. I'm sure they've told you all that. Platelets are good. No anemia. So that wouldn't be causing you to. Because anemia can also cause you to be very lightheaded. So, none of that. Glucosamide was 12.5. It's okay. We'll take it. Okay. Any more questions, Eunice?
I think that was it. I appreciate you so much.
You bet. How are you doing on your glucosamide? Do you know?
I've been good. I haven't had any. I honestly think the side effects are coming from the other one, the clozapine.
Yeah. Do you need any refills that you know of?
No, I'm about to get it here in a minute.
Okay.
Yeah.
I'm going to refill your clozapine though, because we changed the dose and you're going to need more pills for the month.
Okay. Perfect. Thank
And
you.
what's your pharmacy?
Listen, I
I'll get
appreciate
it for
it.
you. Well, thank you for coming in.
Since I'm not gonna see you, I want to give you a hug because
Okay.
it's been a long time.
I've been taking care of you. Thank you.
You've been the best doctor, by the way.
Thank you. You've just been a great patient. I really enjoyed taking care of you. I tell everybody, whoever gets my patients are going to be so lucky because I have the best patients ever.
Thank you. You've
Thank
been wonderful.
you.
One
You
of the
have
best
to.
doctors.
It's been a pleasure taking care of you.
Bye.
And just let me know if there's anything I can do for you before, before I leave or anything. And we're going to have somebody who will be taking care of you, so don't worry.
All right. Thank you so
6
much.
months, okay?
Okay.
All right.
Thanks.
Thank
Bye.
you. Thank you for coming in today.
All right, so as I was here with the neurologist, which she's the best doctor ever, unfortunately she is retiring, which I'm pretty sad, but she has been the best doctor, helps me out a lot with a lot of questions that I have. But I got a call from cardiology that they're gonna give me the holter monitor, so it's the one that goes here again, so you're gonna see that. Another update from neurology here is that I take 200 milligrams of glucosamide in the morning, 200 milligrams at night. And then with clozapam, 10 in the morning and 10 at night. And now it's going to 10 in the morning and 15 at night because I tend to have like seizures during the night when I'm asleep or when I'm waking up, which is why I want the dog. So that's the only change I have here at neurology. And now time for the holter monitor, and then we're heading to my counselor. Hopefully I make it because it's 10 a.m. and my counselor appointment is 10:45 a.m. Here to get my holter monitor?
Yeah, for cardiology. Date of birth?
June 7th? I'm getting a halter.
So let me check you in and then I'll call you once they're ready.
Do you know about I have an appointment here at 10:45. You don't know? Okay. And if I don't make it, what time?
I don't think they'll take long to call you because it's just
a monitor? Okay.
Yeah.
Do you have to go where?
Yeah, the far end store.
The far end? Okay, thank you.
I have you for returning the monitor on Friday, June the 6th.
Okay.
A day before your birthday. So I'm just letting you know you can get the monitor back in time, okay? I usually call a couple of days in advance. Did you drive?
No, somebody brought me.
Somebody brought you? Okay, I was just going to say, on that day, when I call you a couple of days in advance, we just need the monitor dropped off.
Okay.
I mean, if you'd like to or whatever, if somebody's going to be driving you then, I can put my name and number on the paper to where when they're getting close or you're getting close, just call me and I run downstairs and pick it up.
Okay.
You don't have to get out of the car or try to bring it
that's
back
awesome.
up here to the
So
floor.
the
So this will be my direct number. Nobody will pick up but me. If I don't pick up, that means I have a patient in here and I call you right back. It only takes me like a couple of minutes to get downstairs. So.
That's very sweet of you. Thank you.
Yeah, I try to accommodate as much as I can because I know y'all still young people. Y'all got better things to do. Once again, the name of the company is Rhythm Star that's going to actually be looking at your heart. I'm basically just giving you all the equipment to it. I'm going to put it on you to activate it just to make sure the company knows, okay, this is a real person. They do have a heart. She didn't just put somebody in the system and then it's a flat line. So I just need to make sure it's done. The large part goes to the right side. The little part goes to the left underneath the breast. Now, when you take the monitor off for a shower, because you can't shower with the monitor, make sure when you put it back on, kind of move it over a little bit every now and then, because the patches are going to irritate your skin. Even though they're hypoallergenic, latex-free, when you're putting something in the same spot, it's going to irritate it. So just kind of move it over. If it's getting to the point that it's too bad, call the company. This is their number. It's a 24-hour service, 7 days a week. Just tell them you need to leave the monitor off for a day or two because your skin is breaking out. If for some reason you take it off, you forget to call them, hopefully they don't, because what they see when you take it off is a flat line. So if they can't get in contact with you, they're going to panic and think that, what happened? Something's going on, and you don't want to see an ambulance coming to your home. So just make sure you communicate with them that way that they know.
When I move it, is there any way I can put like aloe vera or something like that to help it a little bit and then put it?
If it's greasy, it's going to slide off.
Oh, okay. I got it.
That's why. If it's greasy, it's going to slide off because the electrodes has a little glue on it. So the glue is not going to adhere to anything that's greasy.
Okay.
What I would do, though, if I'm moving it to another spot, I'm going to put some aloe vera on the spot I just moved it from so that that part can heal. Now, this is a little charger that's going to go with the monitor. Basically, while you have it off, you're taking a bath or a shower, or just say you need to leave it off because it's irritating your skin, you just sit it down in the little charger here. This pulls down and you just plug it up to a wall, just like a cell phone. You just plug it up. You want to always see a green light. That green light should always be there when you have it plugged up when it's charging. If for some reason, because the battery lasts anywhere from 24 to 48 hours, if for some reason you forget to charge it, the monitor will make a noise. It's going to vibrate. It's going to go zzz. Zzz. And I don't want you to think it's anything going on with your heart. I don't want you to call me and say, Miss Jackie, my heart, I think it's acting up. Nobody is calling me saying anything. No, the monitor is talking to you. It says, I need some juice. Charge me up. Now, I've given you a 60-day supply of electrodes, even though you're only going to have it for 30 days. But like I said, if for some reason you put it on you, maybe your skin is too moist or whatever, patches are going to fall off. So you just basically dry it off real good, stick some new patches on there, okay?
How long does it take for it to charge?
If you keep it charged daily, it should always be charged. So if for some reason you allow the battery go down and it starts to make that noise, it takes maybe like 2.5 to 3 hours.
Oh, so it's not long. Okay.
No.
Do I have to warn you guys if I'm charging it?
No.
I just know
You have the monitor off longer than 24 hours, that's when the company panics. If you know when your palpitations are coming on, or if you can feel them coming on, if they happen at night or whatever, if you don't know it, it's good to wear the monitor all the time. Other than you taking a bath or a shower, putting it on the charger, let it stay charged every day. And you shouldn't have any issues. You've been out here a lot. Didn't you get a holter?
I did, but it was 24 hours.
Did it show anything? Oh, I'm sorry. So that's why you're here, for new and improved monitor. 30 days. Okay.
My heart has been going down to like 42, even when I'm awake. And I'm like, I think something's going on.
But I mean, you're young though.
I think it's also all the medicine that I'm on.
Okay.
You know what I mean?
Okay. That could be too. Also, if you feel like something is going on, what they did send you over the phone, there's a link that they send that has a diary to it.
Oh, okay.
So if you're feeling anything, it has a list of a lot of symptoms there. So whatever you're feeling, you just check each box. And then you just submit it. That way they can tag that strip, send it to the doctor, let the doctor look at it, and if the doctor call them and say, hey, did she say what was going on? And they'll say, well, yeah, she checked palpitation, shortness of breath, a little tingling or whatever was going on. And so the doctor might have the nurse or the clinic to reach out to you just to make sure you're okay. I'm going to stick this on you real quick to activate it, and you're ready to go.
You mind if I film it real quick? I'm not gonna film it. Just...
And you're getting your new monitor.
I'm getting my new monitor. There you go. By this lovely lady.
Social media.
That's all right. I don't have anything on. I apologize.
That's okay. You're okay. You don't want your fans to see all of that. I know. I'm going to stick it right there.
Thank you.
We're going to get this, and when you take it off, put it back on, then you want to make sure you put it right up underneath your breast. It'll get a good tracing.
Okay.
Now, you're going to see in the middle here where the heart is. It's going to flash green every now and then. You see that green light? That green light is just letting you know that it's recording.
Okay.
Okay? So everything is good. You're all ready to go.
So this one's right here on this side. Do I still need to put it more down there?
You're okay for right now. Yeah, you're okay for right now. We're good.
Heart monitor on. This one is 30 days, so it's different than the other one. And then it's attached to here on this side. I'm going to return it back in the beginning of June. And now I'm rushing to go see the counselor. Miss Jackie said hi, by the way. That was the lady that was putting this on me. I'm back home now. I came out of the counselor's appointment. He said he saw me a little different today, so I can point out what it is. And I said, I believe it's due to how it's been with my doctors and then not really paying attention to me. Yesterday I sent out an email saying, is there any way I can get an appointment to a doctor that knows about rare diseases? Because cardiology wasn't paying attention to me. And then next thing you know, all of a sudden, I get a call for this. Isn't that weird? That's just me. It's always to a last moment with heart situations where I'm almost close to death. I was telling him that I was working out now. And he said, keep doing it, even though you have to do a little less. And he saw my tears go down. It's that it's always till the last moment, or when it gets scary, that they pay attention to me. And he said, well, when you're falling down, you're getting a lot of seizures, or you can't do basic stuff anymore. That's when you need to contact the emergency or go to the ER. And I said, I'm already there. I just fell 2 days ago. This is the third time I've fallen this year. And he's like, then I suggest that you talk to your psychologist, your neurologist, and the cardiologist to make an appointment where the three of them are together with you, and they can talk out what are the options they have. So I might do that. But yeah, these were my 3 appointments. It's been a little sad. I'm going to do something that's going to make me happy, though. Because I got this over here. She put it over here, and it's supposed to go over here. So we're going to change it. This is the pamphlet. And it says what's included. Wearable monitor, please. Charging base, USB power supply. So it shows you how to turn it on and everything. This is essentially it. I don't know if you want to pause it so you can read how it goes. I'm a little confused because last time I had it, I don't know if I had it on the right side or the left side. But for sure, it goes under. There's a male version and a female version. It's right here. So I need to put under. All right, one thing that I forgot to mention is that it also comes with a charger. This is the charger, and it charges up to 2 hours. But if I don't have it on for 24 hours, they call the ambulance to come. Also, over here, there's a note, and it says the number to call, and if you're having symptoms, tap twice on the device. This will provide the doctor with a reading for your final report. Remember to charge your device when the light turns red. Do not shower with the device on. In my mind, I just went no. In order for your doctor to make a report on you, please remember to return the device in the bag on your scheduled return date, which is June 6th. All right, I'm gonna change this. She gave me a whole bunch. It goes under here, right? You would think I know by now since I've had this for a while. Ew, I hate these. It's these. Oh, okay. it's so tight. I think it doesn't help that I have a big chest. All right. All right, it's on. Another thing that I forgot to mention, there is also this, you can press what you're feeling, like the symptoms you're feeling. My watch alarmed me earlier that my heart rate was at 46, so I put down that I was resting. So I have set it already. It's alarmed me 3 times already today, but we'll see what they do. But today, I just want to rest, to be honest. I don't feel that well. I feel tired since the past 2 days I've been having symptoms. If anything happens, I'll update you later. After this, I got really tired, guys, so I'm gonna end it here. My heart, as in the watch has been going off, that it's been going down. Alrighty, I'll see you guys later. Bye.